Okay, welcome back to All Things Psychology. I'm Dr. Tyson. Today we're going to talk about something everybody can relate to, which is anxiety and worry. Everybody has it, and if you don't, then there's something wrong with the brain or psychopathy or something like that. But almost everybody can relate to this. Anxiety and worry. Anxiety comes in many flavors like obsessive, panic, generalized anxiety, many different kinds. But all of them have something in common. Oh, and there's PTSD too, but that's kind of a little bit different. The components of anxiety are two. The first one is that there's a threat out there that hasn't happened yet, right? Like the conversation with the boss tomorrow, or the court date, or like getting on an airplane, or getting on an elevator, or maybe you ate something and you're worried you're going to get sick. So there's a threat out there and it hasn't happened yet. And the second component of anxiety is that you're vulnerable to that threat, and that's what will start the anxiety. Now, there's an important distinction between anxiety and fear. Fear is what you feel physiologically like an animal, like say when the bear is about to jump on you, or the plane is crashing, or something really dangerous is about to happen. That's fear. Anxiety is different. It is anticipation of a threat that hasn't happened yet, and you're vulnerable to it. People often judge anxiety to be a terrible thing, which it's not. There's a difference between pain and suffering. So in life, pain is inevitable. You're going to get worried. You're going to hit your thumb with a hammer. But suffering is everything we add on top of it. If I hit my thumb with a hammer and I say, oh, I wish I hadn't done that. Well, you did it. So you just have to deal with the fact that you're having it. And the fact is that you're going to get nervous. And if you're going to wish it wasn't there, you're going to try and get away from it. It's not going to work. And then you cross the threshold from pain into suffering. Now, worry has an avoidant function, and worry is the hallmark of generalized anxiety disorder. And generalized anxiety disorder comes with things like irritability, muscle tension, lack of sleep, difficulty concentrating. There's lots of symptoms. But the most important one is worry. And that's where you sit there and you think about something over and over and over again. Maybe you're lying in bed thinking about some problem that came up, or some conversation that you're going to have, or something that might happen, and you sit there and you try and figure it out. Like maybe your credit card got stolen or something like that. And you're sitting in your bed, or on your way to work, or in your meeting, or with somebody that you care about, and your mind is going over trying to figure out how to solve it, right? You're trying to figure out how to solve this fictitious future event that hasn't happened yet. And what happens is it's an attempt to reduce the anxiety, that if we sit there and think about it and we come up with a solution, then our anxiety will go down. Well, in fact, it's a trap. It will keep you anxious longer. It'll keep the anxiety around longer, more intensely, and more frequently, and you will stay worried and anxious longer. And people will do, here's the real trap with that. Like say you come up with a solution, you're like, okay, that solves everything. And then there's this little thought that comes in that says, what if? Now, if you have the what ifs, then you're going down this route. Because the what ifs never stop. I had a client who was wanted to date a girl at a dance. He wanted to go dance with a girl, and he says, well, what if she says no? And I'm like, well, what if she says yes? Well, what if I'm a bad dancer? Well, what if you are a bad dancer? You can still dance with her. But what happens if you dance well? Well, what if she doesn't like me afterwards? The what ifs never stop. You'll drive yourself crazy. And that's what people say to themselves. They drive themselves crazy. Now, the defenses in generalized anxiety and in obsessive tend to be like perfection, like trying to be perfect and undoing things and being compelled to do things. And then other things people will try to do is relax themselves. They'll try and relax. And there's room for, progressive relaxation, for meditation and all that stuff like that. But in the end, it won't work any more than distraction or drugs and alcohol. If we're going to talk about obsessive compulsive, it actually comes in two flavors. There's the obsessive personality, and there's the obsessive compulsive disorder, like people washing their hands or counting up to magic numbers, or they have to turn the lights on and off 3 times, and they get worried about something. Like I had somebody who was worried they would get bed bugs if they sat on the couch, and the idea is not to relax your way out of it, not to drink your way out of it, not to figure it out, not trying to solve the problem. The idea is to tolerate the uncertainty, to tolerate the anxiety, to go ahead and sit down on the couch. And the idea is that people want to say, well, don't worry about it. This doesn't make any sense. Well, it's not. It doesn't make any sense. That's right. That's why people are afraid to sit down on the couch. But if they do that, if they lean into the anxiety, then they will find some relief. They will stop worrying so much. They will stop the muscle tension, the lack of sleep. They'll stop the avoidance, and they will actually find some relief. Also, there's this idea of the panic disorders, which it's not an idea, it's real. Your body all of a sudden becomes super panicked, and people feel like they're dying, they're short of breath, their heart's coming up, they're shaking, they're dizzy, they're having hot flashes, they feel like things aren't real. And they come in 2 flavors of the first kind, which is cued and uncued. One is like something happens in the environment that causes the panic, and then sometimes people are just sitting there. I had one that worked at a famous newspaper. All of a sudden he had a panic attack, fell down to the ground, and it came out of nowhere, and it drives people crazy. But the good news, I've got good news for you, is panic cannot hurt you. Even though you think you're dying, and it's easy for me to say, like, oh, you think you're dying, you're not. It's perfectly harmless. But when you really feel like you're dying, you're really scared. And it's really uncomfortable. And speaking of the guy at the newspaper that fell down, he passed out because panic comes in another 2 varieties: vasal responders and non-vasal responders. And what happens with the vasal responders, they pass out. They actually do pass out. And what they have to do is sort of tense their chest muscles to keep the blood up in their brains. But everybody else feels like they're going to pass out, but they really don't. And it's perfectly harmless. But if you're someone who's going to pass out, make sure that you're somewhere safe when you start to feel the onset. And there's interventions for anxiety, which I'll talk about another time, that can actually solve that. I'll make a note to myself to talk about that, because there's so much to explore here on relief and how to deal with the anxiety. But we want to tolerate the uncertainty. That's the real trick. And there is a solution too. There's a solution to the anxiety, because the anxiety is about a fictitious future that hasn't happened yet. And the answer then, whether you're lying in bed, or you're going to panic, or you feel like you can't sit on the couch, is to realize that there's a lot of power in being here now. That when you're in your bed, there's no way you're going to think your way out of whatever problem it is tomorrow. It's time to go to bed. You cannot solve the problem tonight. The idea is that if you draw attention to the present and realize that you're not in any danger, that what you're going through is what you're experiencing is stuff that your brain is telling you. And that's what we'll talk about next time in mindfulness, because mindfulness has a power to help you with all of this anxiety, and it can lead into other treatments as well. So I guess that's something that we're going to have to address, is the treatments, the medications, the downsides of the medications. But remember, there's a lot of power in being able to respond to what's happening in the present. That allows you to dance with the person. It allows you to go to the office. It allows you to go to sleep. It allows yourself to pay attention in the present. And funny enough, it will decrease your levels of anxiety by being okay with it now. It will pass all by itself. Okay, so why don't we stop here? If you can, if you like what you're seeing, because it comes in little doses, please subscribe, because there's much, much more to come. And having said that, that is all things psychology.